I'm Meghan Walker. I'm here at Mary Gates Hall where over 750 students are showcasing their research at the 13th Annual Undergraduate Research Symposium. The symposium is organized by the Undergraduate Research Program. It gives students a chance to present what they've learned and to discuss the connection between research and education.
I'm with the psychology department and I'm researching gender, social anxiety, and drinking motivations. So basically, I found that there are two different things going on. So some people say people with social anxiety tend to drink more, others say that they tend to drink less. So then I took a look at this interaction and found that actually men who have high social anxiety are going to be drinking more in situations where, it's like a party and they're going to be drinking more and they're socially anxious, so that just ups the whole problem.
I did a literature review with Dr. Barbara McGrath, and I just wanted to see what it needs to be studied when you're dealing with women who have HIV and who are homeless. And I found three areas of interest. One is attitudes or stigma. Another is prevention programs, and another is intervention programs. And the most interesting part was that there isn't much out there in the way of intervention programs. And in nursing, we're really emphasizing evidence-based practice. And so I'd like to continue on after this, looking into intervention programs and doing some studies and having them peer-reviewed.
I'm doing wood smoke air monitoring in Seattle, Tacoma areas. So I was looking at the wood smoke concentration and particulate matter 2.5 concentration in these areas. And we have 4 monitoring sites in these areas, 1 in Seattle, the Warmish, and 3 in Tacoma.
So my research is looking at infant thresholds in hearing tests. It's well established that infants have higher hearing thresholds in tone and noise procedures, where there's kind of a background staticky noise, and then they're supposed to detect a tone. And we're not completely sure why that is. There's a couple of leading theories that it has to do with their poor attention, and also that their brains might not process or segment information as well as adults do. So what my research was looking at was a way to increase their attention by giving them a warning of when they should be listening for a tone. I was going off of a study that my advisor had done previously using an auditory click.
So I've developed an interaction technique for helping people with motor impairments select icons on a computer desktop. So one of the problems for people with motor impairments, there's lots of really small icons, and it can be really difficult to select them. They have things like tremors and spasms and just generally hard time pointing on small targets. And so what we've done is use techniques such as an area cursor and goal crossing to eliminate the fine pointing parts of the fine pointing parts of movement on the desktop. So what this does is it makes the interaction easier and faster and a lot more efficient, so they have a lot less errors when selecting icons on the computer.
So we welcome all 750 participating members. Enjoy, have fun, and revel in the fact that in this one respect, as in many others, the UW is number 1.
This is Meghan Walker reporting for the Double Shot from the Undergraduate Research Symposium.